Thank you for attending our virtual education series on tummy time tips. So my name is Brandy Plas. I am a pediatric physical therapist, and I've been working for Cleveland Clinic Children's Therapy Services and in the NICU for the past 7 years.
And my name is Deb Langendoen. I am also a pediatric physical therapist at Cleveland Clinic Children's, and I have been doing outpatient pediatric physical therapy for about 22 years.
So we are just going to review our objectives for this presentation. So we will cover the following topics. So what is tummy time? Why is tummy time important? Typical tummy time skill progression based on baby's age, a review of safe sleep, and how physical therapy can help. So what is tummy time? Tummy time is any time a baby is placed on their tummy when they are awake and alert. And it's always important to remember that tummy time should always be supervised by an adult. You should never leave a baby unattended when they're placed on their belly. Why is tummy time important? Tummy time is important because it helps develop motor skills and keep baby on track to meet their milestones. It also helps to strengthen baby's neck, shoulders, back, and core muscles. And these are important because these muscles will help later on with your baby as they get a little bit older and start to crawl, as well as help with fine motor skills such as handwriting, feeding, and dressing. Tummy time is also important because it can help prevent flat spots from developing on the back of the baby's head.
Tummy time skill progression. As we look at what babies are able to do at 1 month of age, they are able to briefly lift their head and turn their head from cheek to cheek to look left and right. Their typical posture at 1 month of age is a curled up C shape that mimics the in utero position. Some tips and tricks for working on tummy time at 1 month of age are putting the baby on your chest, so your chest to chest position on a flat surface or a reclined surface. You can also put the baby on your lap, and for improved tolerance, you can distract the baby with singing or rocking or gently patting their back or bottom. At 2 months of age, typical skills for an infant include lifting their head to a 45-degree angle on their belly, as well as positioning their elbows behind their shoulders. They're not yet lifting their head consistently in midline. They might have their head tilted to the left or to the right. They should be able to look both ways and not predominantly look one way more than the other. Some tips and tricks for tummy time are babies can spend a few minutes after every diaper change on a flat surface to help make it into a routine. Additionally, you can work on incline tummy time on your chest or over a towel or blanket. At 3 to 4 months of age, typical progression of skills for tummy time include the infant is able to turn their head from side to side with a chin tuck. The baby is also able to prop on forearms with their head in midline, and the baby is starting to be able to lift their head even higher. So now their head is lifted 45 to 90 degrees. Some tips and tricks for working on tummy time at 3 to 4 months include continuing to work on tummy time on the floor with a toy in front of them to encourage them to lift their head up higher. Additionally, you can get down to their level and talk or sing to them and get them to look up at you. At 5 to 6 months, we see that the babies are starting to straighten their arms when they're propping on their belly and pushing their chest off of the surface. Additionally, babies are beginning to roll from their tummy to their back. Babies are reaching for toys when propping on their arms. They should be reaching with their left arm and their right arm, and they will be weight bearing on open hands or starting to weight bear on open hands. Some tips and tricks for working on tummy time at 5 to 6 months include raising toys up on a folded towel or putting them on a book, or using taller toys to encourage them to press up on straight arms and to be eye level with the toys. My baby does not like tummy time. Once baby starts to fuss, you can try to calm the baby by singing or talking to them or distracting them with a new toy. After around a minute of fussing, go ahead and roll them over to their side or back and distract them with toys or interactions. And then once they're calm, then you can try again. Place them back on their belly and give it another try. One tip that we have is to try to keep their arms tucked under their body. You can see that especially in the picture in the middle. This will allow them to lift their head higher and for longer periods of time. Additionally, you can try incline tummy time, such as on the picture on the far left and on the far right. And additionally, you can take a little extra time after eating before you do your tummy time so that the baby has some time to digest.
So, just to review safe sleep. So, safe sleep is what the American Academy of Pediatric recommends, and that is that the baby should always sleep alone on their back and in a crib. And this is to help reduce sudden infant death syndrome. So, baby should sleep alone. Baby can share the same room as the caregiver, but they should never share the same bed. You can place the crib near the caregiver's bed, and you want to make sure you keep the room free of smoke and pollutants and not to overheat or over chill the room. We should always place baby on their back to sleep and to nap. And a way to help prevent flat spots from developing on their heads is to alternate which direction their head is placed every day. So like the picture shows, on even dates, you can point the baby's head on one side of the crib, and on the opposite dates, you can put the baby's head on the opposite. This gives the baby an opportunity to turn their head both ways to look at you. And then the last one is that the baby should sleep in a crib or a bassinet. This is referring to a firm, flat surface, and we want to keep the crib or bassinet empty, meaning no blankets, pillows, toys, or bumper pads. You can use a tight-fitted sheet, and to help keep baby warm, instead of a blanket, you can use a sleep sack. Just just a few other reminders when it comes to safe sleep. So once the baby can roll over by themselves, which is typically between the ages of 4 to 7 months old, it's safe to let them choose their sleeping position, but we always want to continue to put them down to sleep on their backs, and if they roll over by themselves, that's okay. And we want to stop swaddling their arms as soon as the baby shows any signs of trying to roll, which can be as early as 2 months old.
If you have implemented the techniques reviewed in this presentation and are still having a hard time getting your baby to tolerate tummy time, or if you have any further concerns about tummy time or concerns about head shape or development, you can talk to your pediatrician and request a referral to physical therapy. We hope that this information was helpful, and we hope you enjoy your time with your baby.